6 months after the first COVID-19 cases were reported in Barbados and the Eastern Caribbean countries, the number of cases remained within the health system's capacity in all countries. Despite the low COVID-19 disease burden across the sub-region, PAHO WHO provided timely technical assistance and advice to member states to meet their needs. We remain focused on saving lives, protecting health workers, and stopping the spread of COVID-19. Virtual follow-up meetings were held with national health authorities to finalize the country's strategic preparedness and response plans for COVID-19 response. The incident management team continued to meet bi-weekly, focusing on progress in the implementation of grants in accordance with the country's strategic preparedness and response plans. Webinars continue to be an effective communication tool. Breastfeeding during COVID-19, dengue response in the midst of COVID-19, and ICD-10 coding for COVID-19 mortality were some of the webinars hosted. We provided the Diplomatic Corps in Barbados with a third update on the COVID-19 pandemic. 25 persons participated. Web pages were created for mental health and psychosocial support and dengue prevention and control to be used as resource tools and highlight best practices achieved by member states. Over 100 bulletins and situation updates on preparedness and response activities were produced and disseminated. Several videos were produced and disseminated. Health workers in the Eastern Caribbean were given a voice. They shared COVID-19 experiences. Messages were created on dengue response and prevention and breastfeeding in COVID-19. Case studies were published on Barbados' leadership and regional cooperation in containing COVID-19. Community health workers in Dominica leading the fight against COVID-19. COVID-19 surveillance at primary healthcare level was enhanced in Barbados by the procurement of IT equipment for 4 polyclinics. 58 medical doctors and other health professionals from Barbados, the Eastern Caribbean countries, and the United Kingdom overseas territories were trained on WHO guidelines for ICD-10 coding of COVID-19 mortality. Human resources for health were maintained through the hiring of surveillance officers to support contact tracing at country level. The country office continued to monitor changes in entry protocols and to advise countries based on PAHO and WHO recommendations for the resumption of non-essential travel and the provisions of international health regulations. Capacity for COVID-19 molecular testing was enhanced. This was done through the distribution of emergency supplies of GenExpert cartridges to Montserrat, the British Virgin Islands, and St. Vincent and the Grenadines. Current PAHO WHO's updates on COVID-19 diagnostics were disseminated to countries. The updates included the recommendations for use of antigen rapid tests for COVID-19. We continue to provide countries with personal protective equipment. Infection and prevention control activities in the hospitality sector were supported with the training of 180 hotel workers and managers in St. Kitts and Nevis. Additionally, St. Kitts and Nevis were supported with the training of 100 frontline workers in infection prevention and control at the points of entry. 16 nurses from Barbados, Antigua and Barbuda, and Dominica benefited from training in critical care management of COVID-19 patients. Various countries were provided with oxygen concentrators, ventilators, defibrillators, and vital signs monitors. Procurement and logistics support for the receipt and distribution of COVID-19 equipment and supplies to the Eastern Caribbean countries was ongoing. Partnership continued with the regional security system in support of the COVID-19 response. A vehicle was procured for Barbados to support supply management and monitoring to the isolation and health facilities. A refresher course for the online chronic disease self-management program was conducted. National multi-sectoral mental health and psychosocial support coordinating committees were formed in St. Lucia and St. Kitts and Nevis. Stakeholders' consultation for the school nutrition policy for Barbados continued. Bi-weekly webinars with the British Virgin Islands as a part of the ongoing Bounce Back Stronger resilience campaign was implemented. Panel discussions on gender-based violence and men's health was held in collaboration with the Ministry of Health of Antigua and Barbuda and the Seventh-day Adventist Church. A webinar on preparing health systems for the introduction of a COVID-19 vaccine attracted 55 participants. We are PAHO, and we care.